Welcome everyone. Good morning and thank you for joining us today. My name is Sean Evans. I'm with the Meridian Chamber of Commerce, and the Meridian Chamber of Commerce, in partnership with the City of Meridian and the Central District Health, Crush the Curb Idaho, and numerous partner organizations and individuals are proud to share with you a program to assist the Meridian businesses as they reopen for business. Our campaign is designed to educate businesses on the basic guidelines to reopen based on the Central District Health guidelines and CDC guidelines. It will allow businesses to demonstrate to the public that they're doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today is Tinko Makovic, Program Manager with Central District Health, Amy Stahl with Salzer Health and Crush the Curb Idaho, Kristen Armstrong, co-founder of Pivot Lifestyle and Fitness, and JP Green, the owner of Cycle Bar Meridian. We'll open it up for questions at the end of the presentation, and you can enter your questions at any time during the presentation in the question window. The premise behind our campaign was getting businesses back open and restarting our economy, and this is why our group was started. We initially pursued efforts to get everyone open as soon as possible, but we also saw the bigger issue businesses might face when reopening amidst the COVID-19 crisis was that will the public return to the stores or establishments when they reopen? We're contacted daily by our business members on how the governor's plan applies to their business. When can I actually open? And what guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on the plan or the recommended guidelines, we are here to help Meridian businesses understand them better. The last thing we want to happen to our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishments out of the fear or concerns for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk when out in public, and if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health, then that will build the consumer confidence necessary to restart our economy. Meridian Chamber of Commerce has launched Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As businesses open according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars like this one that will provide information from the Central District Health and CDC on basic guidelines for that industry. Webinars also feature local business leaders that have taken even further steps to ensure that they are reopening in a safe and responsible way. After a business participates in this webinar for their industry, they'll be provided free of charge collateral materials that they can display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These items include door stickers that they can show that they're part of the program, in-store posters that they can use if they need them to display the things that they're doing in their store that follow along with some of the guidelines. It also includes some social media materials so that they can use to share with their customers and the public that they're participating in the campaign. They'll also be listed on our website as a participating business and part of our marketing campaign. The program goes beyond what some other communities are doing by just creating a list of businesses that are complying. We're helping them understand what it means for their business and sharing best practices from other industry-specific leaders. These guidelines are not a one-size-fits-all solution for every business. We don't know what we don't know. These industry-specific webinars seek to educate beyond a sheet of written guidelines. Educating businesses on additional protocols they can implement for their specific type of business is where the value comes in. That value is the safety for their employees and customers. To be in compliance with the governor's 4-stage plan, businesses will only be provided the collateral materials when their business is scheduled to open according to the plan. As a follow-up after opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments from their patrons returning to the stores and businesses. This will assist us in building out our phase 2 of our program and business revitalization teams to support Meridian businesses. Look to keepmeridianhealthy.org website for a full schedule of industry-specific webinars and watch replays of previous webinars. With that, I'd like to turn it over to Dinko Makovic with Central District Health to share with you the guidelines for gyms and fitness centers that are able to open in the coming days. Do we have Dinko with us?
Hi guys, can you hear me?
Yes, sir, we can.
Okay, excellent. Thank you very much. Thanks for having us, Central District Health, as part of this webinar. So on our website, we do have posted the recommended guidance for gyms, which has been created by Central District Health in collaboration with Southwest District Health. And in addition to those guidelines, the state of Idaho's Idaho Rebounds website has also posted the business protocols, or also guidelines for the safe reopening of gyms and recreational facilities that as of now is scheduled to start in stage 2. So both of those guidelines are available, highly recommended for local gyms to reference and to utilize these recommendations.
Dinko, do you want to maybe share some specifics of those guidelines that are to this industry?
Yes, sir. So social distancing is perhaps one of the most important things that will need to be maintained. Traditionally in a gym setting, just based on the layout of the equipment and whatnot, there's definitely areas where it's not feasible to always maintain social distancing. So you want to have a minimum of 6 feet between patrons at all times, and also distancing patrons from employees. Just in the course of people walking through the facility, it would be important for staff and management to monitor the flow of traffic. You know, just try as much as possible to keep people at least 6 feet away from each other. So that's definitely something that will need to be a part of the reopening plan. In like the gym area itself, it might be necessary to perhaps just temporarily decommission some pieces of equipment to ensure that 6 feet of distance is being maintained. So may not necessarily mean taking that piece of equipment out, but perhaps just putting some tape or a cover on it, just to make it very clear that at this time it's not in use for social distancing purposes. And obviously disinfection of high touch surfaces, including gym equipment, something that gyms will really need to standardize is their specific procedure for sanitizing equipment after use by each patron. I mean, is that something that's going to be done by the patron, or is that something that's going to be done by the employee? Or is there an option where it can be done by either or? So that's something that really should be standardized to make sure these surfaces and the gym equipment are kept clean and sanitized. Beyond those things, just screening employees and patrons, making sure that nobody with a fever or any other symptoms of COVID-19 are entering the facility. Cleaning and disinfection of commonly touched surfaces, including locker rooms, special attention to locker rooms and restrooms. So I would say that is very, very important. And then something else that businesses will have to make decisions on is the number of patrons or just people that are allowed in the facility at any given time. So obviously some gyms are much larger, much more spacious than others. So it's just something that'll have to be evaluated, just to ensure social distancing can be maintained. If you have too many people in the facility, if you don't have a maximum capacity that you've set, you could potentially overwhelm your facility just with the number of people present. So these are some of the main considerations and components of a plan to reopen gyms safely.
Thank you, Dinko. I know we've got some questions, so if you'd stick around for the questions, we may get to those here in a few moments. Next, I'd like to, while it's not required at this time for employees to return to work, one of the most important factors that has been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of testing in the Treasure Valley is Amy Stahl with Salzer Health and representing Crush the Curve Idaho. Amy, do you want to share with us a little bit about Crush the Curve Idaho and the testing availability here in the Treasure Valley?
Happy to, Sean. Thank you so much to you and the Chamber for hosting this series of webinars specific to certain industries. That's really valuable information. And I also want to salute you for the Keep Meridian Healthy and Open for Business campaign. I think that helps all of us understand more about the challenges that we're facing in the workplace. As Sean mentioned, I work for Salzer Health, and I'm here as a medical partner with Crush the Curve. We are the ones providing testing. So as I go forward explaining the Crush the Curve initiative, know that Salzer Health in the Treasure Valley is providing the testing that's occurring for employees. If you're unfamiliar with Crush the Curve, it is a collaboration of business leaders, government, and civic volunteers who quickly mobilized at the start of the pandemic to pull together the resources that would allow us to do more testing that would help reassure our employees and employers, help identify people who do have COVID-19 and also do some testing for IgG antibodies. We work together to source the tests and then make them available in the community. As I mentioned, in the Treasure Valley, we are also doing testing in Pocatello, Idaho Falls, and Lewiston, and working with some smaller communities to do testing there as well. The testing itself, the COVID PCR tests are the nasal swabs, the testing that is done to identify if you have COVID-19. We are testing people both who are symptomatic and those who are asymptomatic, and sharing the results in a patient portal that is confidential, and the tests are run through that portal for access by individuals. The IgG antibody testing we're doing in partnership with the University of Washington. That is a simple blood test. We're helping by providing those tests at a temporary location at 10 Mile Crossing in Meridian, at 10 Mile and I-84. Those test results are also shared on the patient portal on a confidential online system, and are made available to people within 3 to 5 days of testing. We're getting a lot of questions about what the cost is for this and the logistics for how you can get your employees tested. If you're interested in the testing, you need to submit information through the crushthecurveidaho.com website. Salzer Health will provide you with assistance. We'll walk you through that process, gather the information for insurance purposes, and help you we'll work collaboratively with you to do a group of employees if you choose. The cost is $95 for the COVID-19 test, $100 for the IgG antibody test. We do bill insurance, but you should know that you need to budget for that in terms of unreimbursed costs. So once again, that's something that we do work with you to coach you through that and provide guidance and help you with the test. With that, I look forward to hearing what the other two presenters are going to talk about in this arena, and will be available for answering questions. Thank you.
Amy. Meridian is home to some of the most creative and successful businesses in Idaho. These webinars help bring everyone together to share what they're doing in their respective industries to reopen in a safe and healthy manner. These businesses are implementing some best practices and are willing to share to keep Meridian healthy and open for business. Please welcome our first presenter, Kristen Armstrong, co-founder of Pivot Lifestyle Plus Fitness. Kristen.
Hi, thank you so much for having.
Right. There you go. You're good. You're good.
Okay, great. Thank you so much for inviting me to be part of this webinar. You know, I think that we were speaking prior to, and we're really all in this together. You know, it's not about who's down the road, who is our competitors. It's truly about being in one team right now in one community, because if we can present a safe place for our community to go and feel alive, and we know the correlation between just working out and being healthy, and also the prevalence of this COVID-19, we can help one another really get through this. And so I am more than happy to share what Pivot is doing moving forward. And by no means are any of us experts in this arena. So as I said, I'm going to share with you some of the precautions we're taking. And really, I think the number one outcome that we all want to do is we want to provide a healthy and safe environment for our members and also our employees. And so we work closely. I am type AAA and I follow the news. I obviously am looking at the CDC. I'm obviously have reviewed the Central Health District's recommendations for opening a gym. And I have broken it down into 3 categories. We have operations, we have our precautions, and we have policies. And when it comes down to anything, I think in life, when we're trying to do something different, and there's kind of a change of our norm, I think the most important thing we can do is communicate with our members, right? What are we doing to keep them safe? What are we doing precautionary to make sure that people feel good about coming back into our facilities? And so communication is key, first of all. I think that being transparent with what we're doing is also key. Anything that we're not discussing really makes people question. And so I think in this industry, the more communication we have and the more transparency we have, the more we're going to end up on top here. And so first of all, with that, I'm going to go ahead and just talk about some of our operations and what we're doing in that arena. Like most, we're reducing our class sizes. We are a class-based facility. We have 3 different studios within each of our facilities, plus a normal main gym, which is like cardio and weight room. So luckily for us, we have had an online registration system from the very beginning. And this has helped us tremendously in how we're going to control our numbers. So our members go ahead and they go to an app, our Pivot app, and they register for a class. So on the back end, we're able to limit those numbers, allowing for the 6 foot in social distancing that is recommended through the CDC and the Central Health District Health. And so for that, we already have layouts. We're sharing those with our members and what that layout looks like. So for our cycling room, our yoga room, and our functional training studio. Also in our gym, we have taken the square footage, we've taken our machines, and we have went ahead and formulated what that social distance requirement would be. So now one of the differences that we've done is we're now treating our gym time as a class. And so in order to use our cardio weight room, you have to pre-register just as you would for one of our classes to ensure that there's not a bottleneck situation, or even when you show up to work out, the mentality of, I want to work out now. We don't want to have anyone hanging out in the waiting room or lobby waiting for their turn, such as some of the retail stores where you have a capacity limit. So we've just basically taken that online opportunity and we have put that into our gym and cardio time as well. Some of the other things that we're doing is we are shutting down our facility for 1 hour a day. and that is between 1 and 2 o'clock. And that is for another deep clean. We obviously are going to continuously have our staff clean. We're going to have our members clean. But what's important is we're also going to shut down our facility. Right after our facility opens, we're also going to allow for an hour for our 60-plus-year-old members to come in right after we've had a deep cleaning of our facility. And we're going to allow them to come in to an environment that we feel is going to be clean, and we're taking extra precautions for that demographic. It's not required that if you are over the age of 60 that you come during that time, but it is an opportunity for them to come in and feeling a little bit maybe safer for their age category. Some of the things we're doing also is we normally have an iPad check-in. We are removing the iPad check-in, so when you walk into our facility, you will walk straight back to the studio, and you will allow the coach to check you in. So as you walk into the room, the coach will check you in, and so there's no need to have any additional touching of the surfaces when you check in. We are going to close our locker room shower. That's just an extra precaution that we're taking. It's really hard to control those locker rooms. We're going to leave our restrooms open, but as far as the congregation that happens and that could happen in our locker rooms and showers, we're asking members for this first phase of phase 2 of reopening, we're asking members to bring minimal to our facility. In fact, we hope that anything they bring can fit in a little cubby hole. So that might be maybe perhaps their phone that they feel like they can't live without, or possibly their keys, but trying to come in with minimal equipment or gear. We also, let's see, we are asking participants as they come in, as they enter a studio, as they exit a studio, and as they enter our main facility, that they disinfect their hands upon arriving and upon leaving. This is going to ensure that we are coming in as clean as possible, making sure that any cross-contamination, that we're minimizing that as much as we can. Part of that, to take it to another level, typically what happens in a class situation is at the end of class, we ask our participants to, hey, if you can please do us a favor, grab some disinfectant wipes or spray and disinfect your area, clean up around you. And what happens is that creates a bottleneck situation. So what we're doing to help that situation is upon entering the room, they will we will hand them a disposable, it's not a shop towel, but it's also not just a simple wipe. It's kind of an in-between rag. It's a rag that can actually endure the disinfectant spray and wipe down. So for example, as they walk in the room, they'll be handed a rag, and they'll have their own disinfectant spray bottle. It's a 3-ounce bottle. And so that disinfectant spray is on the list of, they have a list out there that basically is showing disinfectant sprays that are legitimate for the COVID-19. So they'll each have their personalized disinfectant spray bottle so that when they walk in on their bike or in the functional training room during class, they'll have their own area, their own spray, their own rag to disinfect with. So we thought that would be a great way to potentially kind of get away from the bottleneck situation where everyone's running towards their spray bottle or the 5 spray bottles that are available. So those are some of the things that we're doing. As far as yoga goes, we're asking participants to bring their own yoga mat for this first phase of reopening, in that we will not be renting out mats for the time being until we feel a little bit safer. And so we do have those mats for sale in our facility if people are wanting to purchase a mat for themselves. Some of the things that we're doing that are precautionary is we are asking our staff who are within 6 feet of distance to wear face masks. So our membership services, our coaches as they walk down the hallway, but for instance, when somebody comes in and needs help to be fit on their bike, we are asking our coach to be within 6 foot distance of a participant. So we're asking our coaches, until they are actually in position to teach, that they have a mask on. As far as our members go, we're asking them to take precaution as well. Obviously, it's not mandatory, but we're asking them to bring in a face covering. And as they're walking through the hallway or getting in position, or a coach is helping them prior to class, that they feel safe as well. During class, we understand it's very difficult to work out with a face mask. So because we are adhering to the 6 foot and social distancing, it's up to the discretion of the participant and the coach to leave that mask on or not once they're in position. As far as some of the other things that we're doing that we feel we've taken a step above and beyond, we obviously have made sure that our cleaning chemicals and disinfectants meet the CDC guidelines for COVID-19. Our air filtration system, we've replaced all of our HVAC systems to increase, we've increased the grade of air filters. So now we are using hospital and pharmaceutical grade filters in all of our rooms. We obviously practice in a hot room for yoga, and our HVAC system, always since we've opened, we've prided ourselves on the system that we put in, which is we completely evacuate after each of our classes. So we evacuate that room from that humid, hot condition all the way back down to normal conditions, dry conditions, after each one of our classes. And so we feel really good about that. Our room is completely sealed off in order to eliminate any chance of moisture to penetrate through any surfaces. So there will be absolutely no growth or mold that happens in our facility. We've also we've invested in a electrostatic spraying system. You know, part of the issue with disinfectant is that in order for it to be effective, it has to be left on a piece of equipment for X amount of time, depending on the disinfectant. So we actually are using an electrostatic spraying system that is helping us. It provides a 360 coverage around all the surfaces of, whether it's the bike or our weights or anything that we're using in our main gym area. We'll also be doing that multiple times a day. We have our day porters coming in cleaning. We have our staff cleaning nonstop. So we're doing a lot of things that are above and beyond, but again, this will become the new norm, I believe. We have closed off our water fountains unless we have a water fountain where you can actually put your bottle, so it's a touchless water system that people can use in order to stay hydrated during class, after class. We are not having any back-to-back classes offered, so that allows people to come in our facility and out of our facility as well without having any wait time at all. We have eliminated our 24/7 hour access until we get a handle on things. We definitely want to keep up on the cleaning. When you provide 24/7 hour access, you don't have control of that as much. Let's see what else. We are, let's see, make sure I've gone through everything. Again, I think it comes down to communication, transparency. Oh, one of the things I didn't mention is that we are keeping a temperature check log for our staff. We're requiring them prior to entering the workplace that they check their temperature using an app and a device called Kinza. And so that's allowing us to be able to make sure that our coaches there's no risk when they come in. We know that they do not have a temperature. We understand that that is just one check mark. There are a lot of times when the signs and symptoms of testing positive, it doesn't always come with a temperature check. However, that is just one more step that we are doing. We have signage outside of our facility as well as inside of our facility, and we've kept it pretty simple. We're trying to make sure that we're not walking in or creating an atmosphere that's scary. You know, I think that there's a lot of stop and there's a lot of red hands out there, and there's just so much information out there that we're all nervous about everything. And we're trying to keep things on the back end. Obviously, we're doing a lot of things to keep people safe, but we also want people to come in and bring the stress levels down. We want them to enjoy a workout. We want them to enjoy that endorphins that they get from their daily routine. And so as they enter into Pivot, we ask them to adhere to our policies, and they're simple. It's called Do the 5. We're going to ask them to stay home if they're sick. We're going to ask them to social distance 6 feet. We're going to ask that they disinfect all equipment after use and wipe up after their own sweat, and disinfect their hands before and after workouts. We're going to have reminders on the mirrors to disinfect their hands. Don't touch your face. Disinfect your hands. Don't touch your face. Simple practices that we all need to remind ourselves of. And number 5, we want people to have fun. We can't forget we're in this together. And again, if there's any questions, to ask our staff, we're open. But again, this week you'll see me on Facebook Live, on Instagram Live, and it's just to connect with our community and our members to make them feel safe. We've opened up our registration for a Monday opening, and we have already had, I've been wondering, what are people going to do? Are they going to come back to the gym right away? Are they're going to feel safe? And I'm pleasantly surprised of what our signups have been. So I feel really good about where we're going. I think we can all learn from one another, and I look forward to seeing what other fitness facilities come out with, because again, these are just some things that Pivot is doing. I love learning from others, and by just, again, I'm sharing my best practices and what Pivot's doing, but would love to learn more and how we can be better in doing this as one community. So if you have questions, I'll be on the line. I look forward to hearing from JP and what they're doing at Cycle Bar. And again, thank you for joining. This is really important. This is an important time for all of us.
Thank you, Kristen. Appreciate you sharing. JP, you want to share some things that maybe your organization has come up with and things that you're doing in your situation for your members and guests?
Yeah, thanks, Sean. And again, thanks for inviting us to be a part. And thank you, Kristen. Those were some great insights that, shows you've taken a lot of time in preparing your business to get up and get going. So, I would say one kind of somewhat fortunate thing for us is a lot of our normal business practices that we had already had in place kind of follow the CDC guidelines. We're fortunate being a boutique studio that, a rider comes in, we only do indoor cycling. And so those individuals come in, they use one piece of equipment, and then they leave. Obviously there's a few changes that we've had to make. Pre-COVID, our studio was 1,100 square feet and we had 50 bikes. Obviously that isn't going to work in this certain environment. So we've already measured out the studio. We can fit 19 bikes, having them 6 feet apart. So that is obviously the first step that we're doing to ensure that, our riders are safe and social distancing is occurring. We also have already spaced the lockers. So knowing that we're only going to have 19 people in the facility at any given time, similar to Kristen, everything that we do is done online. So people pre-register so we can limit our capacity. We've also adjusted the lockers so that as people are putting their things in place, they will be able to maintain that 6-foot distancing. Similar to Kristen, we are closing our showers. Again, just too difficult to try and manage that. Another step that we're taking, we prided ourselves, we have our Cycle Bar water bottles, and as our riders would come in, our staff would run to them and ask if we could fill those up. Obviously, for these new times, we are encouraging our riders to bring their water bottles in and have those filled. And if they do need to use the water station, we have a hand sanitizer, as my kids are now calling Hanitizer. So you can shorten it to Hanitizer. But we have a hand sanitizer that's sitting next to the water fountain. We also have hand sanitizer stations outside of the restrooms, encouraging our members and riders to use the sanitizer before and after using the bathroom, and obviously washing their hands. We've went to a similar to Kristen, we have an iPad where people check in. When people come in, they will no longer use the iPads. We will check them in remotely. We also have one of the digital temperature readers, so we will be measuring our staff and measuring our riders when they come into the facility. We're still looking for guidance on what is that temperature level. Is it 98? Is it 99? Is it 100? Is it 101? What is that guideline? As of now, we're thinking probably in the 100 to 101 that we have conversations and, recheck, but that's kind of one of those unknowns where we don't really know, what that level is that we should be monitoring. But over the next week, we'll get that ironed out and communicate to the rest of the staff. Another big step that we've done, so our classes are 45 minutes, and normally we had a 30-minute turn time where a class would get out, those riders would get into their clothes again, and then we would have the next class that would come in, and there'd be overlap, which from a community perspective is great, but during this time, we added some additional time in between classes so that when those 19 people complete a class, they have time to completely exit the facility before the next class starts coming in. It also provides extra time. We have disinfectant wipes that are in the studio, and our riders have always been a great community and disinfect their bikes themselves, but we're going to go through after every class and disinfect every single bike thoroughly, not just the major touch points. It'll be a thorough deep clean. So, and all of our staff will be in masks. We're going to encourage our riders to come in, but it won't be mandatory. But our staff will be in masks, and obviously our instructor will remove the mask once they start teaching the class. But it's extra steps, but a lot of the things that we had been doing originally were already in place, and so it's just enhancing those things to make sure that we're following the CDC guidelines and providing a safe and effective place for our riders and our members to be able to work out. So hopefully there's some insights there that will help, and definitely open to any questions and feedback.
Thank you, JP. I appreciate you taking the time today. You answered one of the questions already. It sounds like both of you are closing your shower facilities. It's not going to be an issue where the guests can shower there. They need to leave the facility after that.
Yes, I've had quite a few questions from, obviously we have one facility, well, we have both of our facilities that are very business centric. And so, we've already had a few people after my newsletter went out on Thursday about the concern of not being able to work out during the day. And we are doing our best to, as we enter into phase 2, but phase 1 for us, I want to see and take as many precautions as possible in these first 2 weeks. And so one of the things that business people may have to do is really think about working out after work if they're concerned about going back to the office, sweaty. I also it's really difficult it's one thing to control the locker room and making sure that people aren't too tight in there, but it's another thing, as JP could attest to, as people start showering and waiting in line, it can become quite a bottleneck. And I think that it's really important until Boise and Meridian say, hey, we're going to enter into phase 3, that we take as much precaution in the first 2 weeks. And so it's really only asking everyone, hey, let's just be patient for 14 days and see where we are.
Okay, excellent approach.
The other thing I wanted to mention, JP, is this is really interesting because I had the same question around the temperature. And as I was reading the Central District Health flyer, it's basically stating that they consider, the CDC defines a fever as anything over 100.4. So just so
Great,
that you,
thank you.
I'm sure everyone has that question.
Dinko, do you want to chime in on that? Is there any additional guidance that you have on temperature checks?
What Kristen just said is 100% correct. Per the CDC guidelines, a fever is considered anything 100.4 or higher. If you try to research this stuff online, there's a lot of articles, a lot of guidelines from different organizations, and I personally have seen numbers anywhere from like 99 to 101.5. So it's somewhat not very clear, but technically per the CDC's guidelines, it is 100.4 or higher.
Okay, excellent. We do have a question, and Dinko, this may be for you as well. This is from Elizabeth Aller. I'd like to know about hotel exercise facilities and pools. They do have, we do have the option of limiting the amount of guests that can enjoy a fitness center or pool. Will we be able to open our pools to a limited amount of guests? Or when in general can we expect to be able to make use of our small gyms?
Well, I believe it's the hotel's responsibility to maintain the same level of cleanliness, sanitation, and safety as would be expected of a gym that somebody could get a membership for and go to on a daily basis. I mean, you could even make an argument that in hotels, it's even more important because, you know, we're talking about possibly travelers from other cities and other states going through that facility. So in my opinion, hotels, if they do have a gym area, they should be trying to implement the same control measures as any other gyms are. And regarding the pools, at this time, there's really no evidence that COVID-19 can be spread via exposure in pools or hot tubs, but definitely social distancing still must be maintained. And of course, just making sure the water chemistry itself, the chlorine levels, those are all at the proper levels to make sure that if any sort of pathogen is introduced in the water, it's not going to be something that people are exposed to because it'll be disinfected by the water.
Okay, that answered the follow-up question. Was there any special guidance for pools in facilities? Okay, let's see if we've got any more questions here. Got the shower question, pools. Okay, I don't see any other questions here right now. So with that, I just want to once again thank all of our participants for joining us today. And please help spread the word to all Meridian businesses that we're here to help them open in a safe and responsible way. And we want to keep Meridian healthy and open for business. Be sure to answer the follow-up survey that we'll be sending to your email so the collateral materials can be available to you today. Visit keepmeridianhealthy.org for more information on this program and sign up for future webinars. Have a wonderful week and keep Meridian healthy and open for business. Thank you all very much.
Thanks, Sean.
Thank you. Stay healthy.
Thank you. We appreciate it.